Welcome back. February is American Heart Month, and this morning we're going to focus on staying heart healthy.
Yes, we are here with Dr. Tina Pham, pediatric cardiologist with Texas Children's Hospital. Good morning, doctor. Thank you for being here.
Good morning. Thank you for having me here.
Yeah.
Okay, super important. Let's talk about heart health for men and women. How important is it to really focus on being heart healthy?
Yeah, it is very important to focus on being heart healthy, and being heart healthy is just a series of lifestyle choices that includes everything from being active, staying active, to eating a healthy diet, and then also avoiding the risk factors that can increase, your risk of having heart disease, such as excessive alcohol consumption or smoking, but really being proactive and getting moving. I think that's one of the keys to being heart healthy.
Well, and you approach this as a pediatric cardiologist, but let's be honest, this heart of ours is super important forever, for all ages, right? So does some of the same advice kind of cross over from kids to adults?
Absolutely. I think the earlier you focus on being healthy and making these lifestyle choices, the easier it is to translate from being a kid into adulthood. So, at every visit, we always ask about the diet and, how much physical activity, what types of physical activity you're doing at the cardiology visits. And so helping to sort of build that habit and maintain it throughout adulthood.
Talk about stress, doctor, because stress can be pretty hard on our old ticker, and you also have like a specialized interest in stress testing the heart. So tell us about both of those.
Yeah, definitely. There's definitely a neurocardiogenic connection to where stress does increase, anxiety, and that can be not good for your heart. But at Texas Children's, we do have a exercise stress test that can be used to diagnose patients with arrhythmia disorders, and also if you have symptoms with exertion such as chest pain or shortness of breath with physical activity, then the exercise stress test can really help diagnose, even exercise-induced arrhythmias or exertional asthma, and then can also track your cardiac fitness over time for patients who have had heart surgeries.
Interesting. And how young are you seeing patients maybe with some of these issues that need to be addressed?
So patients that we see can be diagnosed with a heart disease even in the womb. Wow. And so we follow them throughout the course of their lives. But then there are also patients who have a perfectly normal heart who develop symptoms such as chest pain or heart flutter that develop sort of in their teenage years or even older than that.
Interesting.
So.
How do you know? I guess the best thing is to just contact your doctor, right? So how do you know the difference if it is just maybe anxiety or stress, or you're in a stressful situation versus, hey, I really should get this checked out?
Yeah, exactly. So there are a lot of different, the key is the history that we do. So usually if you're hearing that you're having these symptoms with exertion, or if you're fainting every time you're doing a physical activity, those are the things that we say have your primary doctor refer to the cardiologist for evaluation.
Yeah. And a lot of times we tell people, before you start anything new, you do want to talk to your doctor. Is there something safe or relatively safe for almost everyone, like just going for a walk in the morning, or do we really want to make sure we're not doing something that's bad for our heart?
Yes, in general, physical activity has been shown to be beneficial for everybody. There are very rare diseases that we say you cannot be active, but even so, we try to make ways to allow patients and kids to be as active as they can, to live as normal of a lifestyle as they can. So there's, going for walks, that's safe.
And is there a correlation for, let's say, our children are playing sports, or they're active? Is there a correlation into older age and having a stronger, healthier heart long term? The sooner we start maybe makes it last a long time?
Oh, absolutely. The exercise and being active not only is good for your health in that it can lower your bad cholesterol, it can also increase your good cholesterol. So if you have that foundation going into adulthood, your heart's already going to be healthy. So definitely.
It's never too late to start, right, doctor?
Oh, absolutely.
Yes.
And it can also be, just a little bit at a time. It doesn't have to be, for hours at a time. So even if it's 10 minutes every day for a few times a day.
Well, this was my New Year's resolution. I said, I'm going to do a little bit because I kept asking myself, why is 15 or 20 minutes scaring you? Why am I so scared to just do it? I said, well, just do it. Make it the first thing of the day. Get the 15 minutes out of the way, and I've been doing it for a while. I feel a lot better.
The exercise
but
snacks.
it takes a little right. But it takes that first step. It's such a hard one to take sometimes.
Yeah, and absolutely. And not only are you physically better, it's been shown to be more mentally. It'll help you with the psycho-emotional aspect of it.
I have to ask my kids if I've been more patient. I don't. Probably not, but maybe.